Hey everyone. I know that I said that I would film it a while back, but I'd like to talk today about why I get my transition care through the VA and what that has looked like. Sometime in 2019, I had decided that I wanted top surgery, and I knew that I wanted to pursue medical transition. So I'd gone to my primary care doctor and mentioned that I wanted to talk to somebody about my options for pursuing medical transition. I am a medically retired veteran. I was in the Navy for 5 years. So I pay for Tricare, which is the military's um, provider for health insurance. And it's kind of a complicated system because I pay premiums, and those premiums are locked in to when I retired. And I'm allowed to get my medical care either through the base, which is free generally if they have room. So a lot of times the base doesn't have enough providers. My other option is I kind of have a secondary insurance. It's Humana Military, and it's still Tricare, but they are the provider for Tricare services off base. And for a while, it wasn't bad. Our copays were like $12 for most visits, but ever since Humana Military took them over, our copays, garbage truck, our copays, our copays are now $36. So I try to get my care through the base as much as I can. And so when I went to talk to my doctor, he suggested that I talk to a therapist. Sorry, garbage truck, and then I knocked my mic off. So I talked to my doctor about pursuing medical transition, and the way that primary care works on base is that generally they put in a referral to referral management. And so my doctor put in a referral to referral management, and nothing happened. I had a follow up appointment with my doctor about 3 months later, and I said, "Hey, look, I really want to pursue medical transition. This is important to me. I want to talk to somebody." So eventually they put in a referral for endocrinology. And unfortunately, there isn't an endocrinologist on base. And this took a while for us to figure out because I had to go back and forth with the referral management center and my primary care doctor's office for a couple months, honestly, because they had a couple of active duty patients who were in the middle of medically transitioning. Unfortunately, the endocrinologist that they're using is actually in another state and is all the way across the country. And so they were just moving people to Texas instead of having an endocrinologist locally. So they referred me to an endocrinologist out in town. And the problem with that is Humana Military kept denying the referral. And they wanted clinical proof that I had been trying to transition for a year before they would even let me talk to an endocrinologist. And so my doctor and I, this had been about 10 months now that I had really been trying to figure something out and talk to somebody. And so I got a new doctor. My primary care doctor was a military doctor, and they ended up switching because my doctor went on deployment. And so my new doctor said, "Hey, I have a really good idea. Why don't you try the VA clinic? Because the VA has more resources for stuff like this than we do." So I signed up for a program, and it's actually a unique program where I see VA doctors at the military medical center. And this is beneficial because it lets the VA doctor use the resources of the base. So I signed up and got an appointment with a VA doctor and changed my primary care provider. This was after about 10 or 11 months with fighting with Tricare and Humana Military to try and even just talk to somebody about medically transitioning. During this time, I had gotten a referral to a therapist, and I had been talking to a therapist for about 6 or 7 months at this point. And this is a therapist where I use my Tricare to pay for the therapist, but the copays again are $36 every time I go see my therapist. And so My therapist 100% gave me a letter condoning, like, this person is ready for medical transition if this is the step that they decide to take. So I talked to my new primary care doctor who was through the VA, and we decided to for me to talk to endocrinology through the VA, because the VA had a very good endocrinologist local to the city that I live in, or it's local to the city where I go to the doctor. It's actually about 20 or 30 minutes from where I live. So I talked to my doctor. It was on like a Tuesday morning. By like Tuesday afternoon, endocrinology called me, and I made an appointment for 2 or 3 weeks later. I went to that appointment and talked to, it's a nurse practitioner. She's an endocrinologist, and we decided that starting testosterone was the right decision for me because I wanted some of the effects of masculinizing hormone therapy, and we talked about the pros and cons and what the consequences of starting transition, and then deciding that it wasn't for me, and I decided that I wanted to try it. So we thought it was going to take a week because I had to go do blood work and I had to do some other stuff. And then she would have to get approval because I wanted to do my injection subcutaneously. So there's two different types of testosterone injection. You can do testosterone intramuscular, which is usually in your thigh. There's some other places that you can do it, the butt, I think. And then there is subcutaneous. So a subcutaneous injection is a much smaller needle. You're less likely to hit a vein or do something dangerous. It can also be done in the belly, any place where it's like more fat, because it's done into the fat instead of the muscle. So I wanted to do injections subcutaneously, and they prescribed testosterone to be injected intramuscularly. They would also prescribe the gel. And so they do have a form of testosterone, and that's actually what I'm on. It's Xiosted, and these are injector pens, and the pens do subcutaneous injections. But I had to get approval in order to do those. And so we thought it would be some time, and I literally got a call back the next day that said, hey, if you want to come pick up your testosterone prescription, you're welcome to do so. So I went and got my prescription and was able to have a nurse show me how to do it and take my prescription home the day after. So this is not even 4 weeks after I switched healthcare to the VA. And it has honestly been amazing. The VA, anytime I've needed anything here, they've been right on top of it. I see my endocrinologist every 3 to 6 months as appropriate. I go into the base to get my blood work done. It's just been an amazing experience all around. And I know that not all VAs are as good as mine, but that's why I get my healthcare through the VA, and I'm very happy. Thank you very much for taking this journey with me today.